I think even previous to the Bill 168 legislation, we recognize that we live in our society, and that we're a larger institution, but we're a microcosm of our universe, and that it's important to recognize that some of our staff may be experiencing domestic violence, and that it isn't something that is a private issue anymore due to the legislation of Bill 168. It is a workplace issue, but it also is a healthcare issue. And as a healthcare and as a hospital environment, violence against women and domestic violence really is a healthcare issue. It has a lot of healthcare impacts. It costs our system a lot of money, and we actually can be a really critical point for patients to access services and get support and help and information about how to deal with these situations. So it really fits in with our mandate as a hospital and a healthcare environment, and also our commitment to human rights and health equity, in that we want to ensure that people are safe and healthy when they come to work. So we've done our office, the Human Rights and Health Equity Office. We manage any cases that are involving our staff experiencing domestic violence. So as part of that process, we've provided training to managers as critical points and key partners within our institution. So human resources, occupational health, wellness, and safety. We have some committee members that are part of our Human Rights and Health Equity Committee. We also have a Violence Against Women Awareness Committee. So we've provided training to these key areas, and we've actually brought in neighbors, friends, and families back in the day when that's what your name was, to do that 2-day full training. And from that time, we've built upon a lot of the information and resources that neighbors, friends, and families have created to integrate that into our own ongoing learning and education of our staff members. And particularly with Bill 168, we've had a mandate now to recognize again that domestic violence is a workplace issue, and that we do have roles and responsibilities if we become aware that a staff member is experiencing domestic violence. So we partner with security services to do safety plans, and we do risk assessments of the situation. And we keep in ongoing contact with employees that are going through these difficult times to do check-ins, make sure that they recognize there's support available, and making referrals in the community if they choose to, whatever choices that they make outside of here. We want to make sure that they have that information and those resources. It's a critical part. Education and training is a crucial part of our domestic violence program here at Mount Sinai Hospital, because we're so trained in our day-to-day life and societal norms to ignore when we might see warning signs. And so things that we've done on our end is we have created our own domestic violence in the workplace policy. So we clearly outline what are your obligations as a manager, what are your obligations as a staff member. So that's very clear if you become aware that your colleague is who you need to talk to. Training of managers is also really, really important, because they already have an established relationship with their employees. Not only, and they also spend they manage their performance, they are aware if they're calling in sick and things that some of those warning signs that they might pick up more often than when we do. Although we get involved when there is a situation based on our level of expertise, managers are playing such a critical role on that day-to-day support information, as well as integrating it into our training. So when we do training on workplace violence, workplace harassment, we also do training on domestic violence. We also have an e-learning module that we've designed that's mandatory for staff every 2 years to take as a refresher, and a part of that is domestic